Parental coaching, very important. We teach the parents, and then the parents coach the children, and abundant of love to autistic children will be very important. So to conclude, autism is not a disease. It is a different way of being that the parents should understand. It's a different way of being. It is not a disease. Hi friends, we are going to be talking today about a very, very important topic, autism, and transforming the children with autism through integrated therapies. That's very important, and giving them the hope. Healing with hope is the title today. And how are you going to do it? At Dr. Sashi's Wellness and Integrated Medical Center. Here we have a lot of children now in India, not only in India, across the world. The numbers are increasing. So what is autism? First of all, it is actually an autistic spectrum disorder. ASD it is called, autism spectrum disorder. It affects children in various ways. They are not able to talk properly. They are not able to communicate with social peers, with the family members. They are aloof. They are not able to, their intelligence levels are varying. They cannot interact with the normal world. But still there is hope. Through a combination of modern science and holistic therapies, we can improve the quality of life significantly. So what is autism? It is a neurodevelopmental condition that affects social interaction, communication, interests, and behavior of the particular child. It's a spectrum, as I told you, because symptoms can range from very, very mild to very, very severe conditions. So what are the types of autism according to DSM-5 classification? So level 1 is high functioning. So it needs some amount of support. They are functioning okay. Moderate levels are level 2, needs substantial support. And level 3 is a severe condition. It needs very, very substantial support, 360 degrees and 24/7 support is required. So the former terms like Asperger's and PDD, NOS are now part of the spectrum. So what are the causes and risk factors? There's no single cause explained for autism, but research has uncovered several contributing factors. They could include genetic mutations, the SHANK3 and MECP2 genes. Prenatal complications, very important, very, very important. Environmental conditions, environmental toxins, gut-brain axis dysfunction, that's a very, very important thing. Mitochondrial dysfunction, immune dysregulation, and postnatal inflammation. So these are some of the conditions which have been predicted, but of the thing which I've told you very important are gut-brain axis. The gut, if it is healthy, the children are much better. Including them in a lot of activities, giving them a lot of activities would improve. Oxygen therapy, because hypoxia in the brain is said to be a very, very important part. So hyperbaric oxygen therapy is a very, very important condition, and it is helping children phenomenally well with autism and cerebral palsy. How? Children with autism, first the parents, including the doctors, think that how we can put that child into that chamber, it's not going to keep quiet. But then the first dose maybe, or the second dose itself, the child wants it. It says, even though it's some people not able to communicate, they say, come, we'll go to that center. I want oxygen. It's craving for oxygen. So automatically, nature is telling, hey buddy, oxygen is less. Please give her oxygen, give him oxygen. He's going to improve. So HBOT is a rising hope in the autism community. So what is HBOT, you might ask. The child breathes 100% oxygen in a pressurized chamber, and it's very simple. Suppose, for example, an aeroplane is a oxygen pressurized chamber. It's not pressurized to the extent what HBOT does, but it's just to give you an understanding. This increases oxygen delivery to the brain and reduces the inflammation and improves blood flow to the areas where the blood is not gone. So in autism, what are the benefits? It improves the knowledge, language. There's better focus and cognition for the children. Reduces irritability. They get irritated very fast. They can't hear loud noises. Their taste, touch, everything is gone for a toss. It enhances their social skills. So what are the studies? I have also taken up a lot of studies. Rossignol et al. In 2007 showed positive outcomes in behavior and receptive knowledge. So one more apart from hyperbaric oxygen therapy is stem cell therapy. Stem cell therapy offers regenerative hope. So how it works? Mesenchymal stem cells from umbilical cord or bone marrow modulate the immune system and reduces the neuroinflammation, and also regenerates certain cells where it should. So clinical improvements observed are better eye-to-eye contact, improved speech, better social interaction, and there are ongoing trials in India and globally, and they are showing promising results. So diet and nutrition, a well-planned diet can calm the gut and improve the cognition of the child. So in autism, diet protocols are, it should be gluten-free, casein-free diet, GFCF diet, gluten-free, casein-free diet, low oxalate or ketogenic diet. You can Google on these keywords. And probiotics and prebiotics are very important. Omega-3 fatty acids are extremely important. And avoid processed sugars, food colors, and additives. So the key supplements should be vitamin B12, methylated vitamin B12, magnesium, zinc, L-carnitine, curcumin, as I told you. These are some of the things which we have. Curcumin, I take it on a regular basis to reduce inflammation. And definitely we have a nutritionist tied up. We also have a person who can supply you with the food which we tell, because making some food because both the parents are working, it could be difficult. So all these supportive therapies we are giving at Dr. Sashi's Regenerative and Wellness Center. So activity-based therapy is very important. Engaging the child's brain through structured play therapy is a very important thing. So these therapies would include applied behavior analysis, ABA, occupational therapy, speech and language therapy, music and art therapy, sensory integration therapy. So the play-based approaches are powerful when combined with parental involvement. Very, very important, I tell you. Parental role is very important. The mother, even if she is going to work, it's very important that she spends a lot of time with the child. Even if need be, they can work from home or alter their timing. It is very, very important. So the entire family needs to support autistic children. Vision therapy is another important thing. Many autistic children suffer from poor eye tracking and visual motor integration. So the vision therapy includes, it improves the eye coordination, reading and learning, visual processing, social engagement are all improved. So what are the tools used? Prism glasses, tracking eye exercises, eye-hand coordination drills. So these are being given on a regular basis at our Dr. Sashi Eye Care. So we have customized vision therapies and plans for the same. So there are brain stimulation therapies as well, because neuroplasticity is the brain's magic. So, and we can guide it. The techniques how we do it are transcranial direct current stimulation, transcranial magnetic stimulation, auditory integration therapy, EEG based neurofeedback. And the benefits are enhanced cognition, reduces repetitive behaviors, improves focus of all the parameters which we have seen. So, integrated care and hope. So, no single therapy works alone. Definitely no. The magic lies in integration. It should be a teamwork. An ideal autism protocol includes functional analysis, diagnosis first, and then hyperbaric oxygen therapy, stem cell therapy, as indicated, clean and anti inflammatory diet, behavior and activity therapy, vision and neurostimulation therapy, parental coaching, very important. We teach the parents, and then the parents coach the children, and abundant of love to autistic children will be very important. So, to conclude, autism is not a disease, it is a different way of being that the parents should understand. It's a different way of being, it is not a disease. With the right tools, the right support, and therapies, these children can bloom beautifully. At our integrated wellness center, we believe in unlocking their full potential. One cell, one breath, one smile at a time. That's Dr. Sashi Eye Care for you, Integrated Medicine and Wellness Center, where science meets the soul. Thank you, dear friends.